Okay, welcome back. I'll slowly do an introduction and let a few folks log in as we're going along, and then I'll start into the webinar. So my name is Dr. David Kanashko. I'm the medical director at Bioflex Laser Therapy, and I'm a chiropractor. Did I say that already? And I've been practicing for well over 30 years. My background actually before that was in molecular biology at the University of Toronto, where I did both undergrad and graduate work. And my involvement in laser therapy has been, well, close to 15 plus years or so now, both as a practitioner and now as a medical director. And today's webinar really is a way of introducing a new product or device from Bioflex, but also our distributors specifically and exclusively for this device, the Healing Movement. And I'll introduce their company and the owner, Dave Poggi, very shortly. So if you're new to these formats, these webinars are always recorded and then uploaded and put on our website. They'll also be put on Dave Poggi's website as well, the Healing Movement. And you're free to watch it again, or if you don't get to watch all of it, you can certainly tune in. Usually they're posted within a week or two. I encourage questions as we go along. I want you to type those into the Q&A box. In the chat box, let me know your name, where you're from, what kind of interest you have in this type of therapy for companion animals. And I think we'll get started. So really what I want to do first is introduce our new device, a little bit about what it can do, the Healing Movement, our affiliate and a distributor of this device, and then specifically a little bit more about laser / photobiomodulation therapy, sort of what it is, what it can do. A little bit about the research. There's a lot of research in the veterinary world. I'll just touch on a few interesting papers that I pulled up, and a little interesting side story on how we actually got into veterinary care, going back with our original owner, Dr. Fred Kahn, over 30 years ago. And then I'll get into the actual system itself, talk about some of its features, how it's used, just some of the basic things. And then I'll introduce Dave Poggi and the Healing Movement, and he'll finish off talking a bit about this device, but also some of the other devices they have to help your companion animal lead a healthy life. So I am a huge pet lover. I've had lots of pets in the past. That was Denver. This is Finley, although technically not my dog. It's my daughter's dog. Those dogs are nuts. This is my feral cat, Sylvester. I feed him every night. And this is Emerson, enjoying himself as cats do, and his sidekick, along with my current cat, who looks a little ominous there. His name is Simba. And that is another one of my, unfortunately, passed away dogs as well, Darwin. And there they are sitting out watching the grass and the squirrels probably. All right. So let's move on. Now, I want to introduce a couple of things. First of all, our new device, the Bioflex Pet Therapy System. Now, this is actually based on our professional veterinary system, and we designed it in conjunction with the Healing Movement, who will be our distributors for this device moving forward. So I'll talk a little bit more about the device, and then Dave Poggi from the Healing Movement will introduce himself towards the end of today's webinar. The system itself looks pretty similar if you're familiar with our human devices, but it has been sort of rejigged and reformatted, including the protocols for companion animals. So it looks something like this. There's a couple of different sizes, as you can imagine. There's what's called a P120, which references 120 superluminous bicolor diodes, a little bit smaller, so for cats probably, or for smaller dogs. And then for larger dogs, we have a P180. The treatment surface consists of bicolor superluminous diodes. So they emit two different wavelengths of light, specifically red, around 660 nanometers, and near infrared around 830, 840 nanometers. The crux of how this system works is it delivers First, the red light. Now, red light is actually a really great wavelength for photobiomodulation therapy. The only downside with red light is it doesn't go particularly deep. So for a lot of issues, in joints, deeper muscles, that kind of thing, it doesn't really get into that area. It can still be helpful around the area, but it doesn't directly get absorbed. For that, you need near infrared. You might wonder, well, why just not use near infrared? So there's a couple of reasons why. The red light actually treats the superficial structures quite efficiently. It also helps the near infrared go a little bit deeper because that light, the photoacceptors that it's trying to target have already been absorbed superficially, so the light actually propagates and goes deeper into the tissue. And again, I certainly welcome questions. If you can put them into the Q&A box, that's where I'm going to be going as we move along. The controller looks something like this. And you can see that there are, oops, I'm going to back up a bit. There are a whole bunch of new features or buttons that are not there for the human device. Now, it's designed for companion animals, basically cats and dogs, from cats and small dogs, medium to large dogs. And you can see here, they point to different anatomical regions. That's what sort of these 8 lower buttons do. But then you can also see there's a little button that looks like a hair follicle. That's for dermatological or skin conditions. And then one looks like a scar or wound healing. And that is indeed for any wounds that your animal or your pet may be recovering from, whether that's post-surgical or some kind of mishap that animals certainly have. It's pretty easy to use. It's ergonomic and quite sturdy. We've been using this type of device now for, gosh, almost 10 years now. And there are visual and audio cues to indicate when to change the positioning of the light pad as well. I want to talk a little bit about the origin of our PET system, and specifically Dr. Fred Kahn, who is the founder of Bioflex. He has since passed away. We had a relationship with a lot of different people, and including Dr. Chip Godine, who is a doctor of veterinary medicine in the United States. And he's been actually past president of the North American Association for Laser Therapy, a huge advocate for laser therapy, photobiomodulation therapy in the veterinary world. And because of our relationship, we actually asked him to help develop specific proprietary protocols based on our human professional system to be used on animals. So he was really critical in helping us design this, what is now actually the PET, Bioflex PET therapy system. Now, the origins of laser therapy or photobiomodulation therapy go back to the 1960s by this physician, Dr. Andre Mester. And now he was quite interested in a lot of different areas, including cancer care. He happened to read an article, a research paper, and it was the first ever use of lasers to eradicate tumors. Now, initially it was done in hamsters, but then he read one that it was the first case in humans. So he tried to replicate that experiment, and he got the parameters and read the information. And he was in Hungary, actually in Budapest. And he had the physics department at the university build him a laser. Now, at that time, there were only red lasers available just by coincidence. And it turns out that red is really critical here. So what he did is he tried to replicate the experiment, and he wanted to first do it on animal models to make sure it was going to work. So he did little incisions in the bellies of rats. So he shaved the fur off or the hair, did little incisions, inserted tumor cells, and then he went about treating it with what he thought was this specific power of red laser. And when he did this, what he found was that the little wounds that created by when he did incisions were healing significantly faster compared to the control, which you can see is in the next picture, but also the hair follicles were growing back faster. So then he wasn't expecting this. He was actually expecting a more powerful laser that was going to actually thermally destroy the tumor. But what he got was this. And it turns out that his laser was calibrated much lower than he wanted. So it turned out to be a class 3B, or what was referred to as a low-level laser device. And he concluded that although it didn't have any direct effect on the cancer, it had an effect on the wound healing and actually the hair growth as well, which is something I can talk about another time. But Specifically, he went on to do more experiments on wound healing. So the next experiment he did, based on the first serendipitous kind of experiment, was that he did little flap wounds on the bellies of rats and compared the control rate of healing, wound healing, to that of this specific wound that was treated with that low-powered red light. And so when you compare, now this is over the same time frame, roughly about 10 days or so, the wound healing that's going on in the laser-treated one, circled here, and whoopsie daisy, and the non-wound healing, sorry, I just have to flip something around here. And the non-wound healing, you can see that the one that is treated with light actually is healing faster. And the other thing he noted was that the adjacent wound to the one that was treated with laser was also healing faster than the control. So he concluded two things. He concluded red wavelength of a certain energy density accelerates wound healing when directly irradiated. But he also concluded that this effect somehow is mediated systemically to adjacent wounds shown in that second sort of circle there. Okay, so this is really important when you're using, I'm going to call it photobiomodulation therapy because that's really what it's referred to as now. You don't need lasers to get this effect. It does two things very interesting enough. It will have a direct effect where you can get light to the tissue, but then the effects are also mediated via the blood, specifically circulating stem cells and white blood cells that help control healing. That's, stem cells do that, and help control inflammation. Of course, that's what white blood cells do as well. So that's really the origins of photobiomodulation therapy. Now, the definition of photobiomodulation therapy is, now this is the definition from the World Association and the North American Association of Photobiomodulation, is it's a form of light therapy that uses non-ionizing forms of light. So that means it's not dangerous. It can be a laser, an LED, or other sources of light. And typically, as I mentioned, it's going to be in the visible red and infrared spectrum. It's a non-thermal process. In other words, it doesn't cause heat, very mild heat from the electrical current, but the light themselves doesn't cause any burning or heating, so it's very safe. The actual wavelengths are absorbed by chromophores or photoacceptors inside cells, and that causes a reaction, a photochemical or photophysical reaction. The best way I can really explain this is that in photosynthesis in a plant, chlorophyll, which we all are familiar with, which gives the plant its green color, absorbs sunlight, and it converts through a photochemical reaction, the energy, the photonic energy is absorbed and converted into another form of chemical energy that the plant can use to grow. That, of course, is called photosynthesis. Now, I'm not talking about photosynthesis for our purposes, but that's an analogy that I think everyone can kind of understand or relate to. So this whole process of photobiomodulation has beneficial therapeutic outcomes, including helping with reducing pain and inflammation, modulating the immune system, and even obviously helping with wound healing and tissue regeneration. How it works inside the cell is somewhat complex and complicated, and I have lots of other webinars on this, so I won't spend a lot of time, but essentially it works through the mitochondria and the mechanism of producing energy or ATP inside the cell. And when it interacts with a specific enzyme in what's referred to as the electron transport chain in the mitochondria, it actually helps to propagate and make more ATP when the ATP ability is inhibited because of inflammation, which again, that's really has to do with an increase in nitric oxide. And this nitric oxide is also important because it gets released through and into the blood, which causes temporary vasodilation. So it helps with circulation as well. It has all sorts of sort of interesting effects, sort of secondary and tertiary to that inside the cell. But essentially what it does is it helps improve mitosis, so cellular replication and tissue repair. It reduces inflammation. It causes localized vasodilation and improvement in circulation. modulates white blood cells and stem cells, can reduce edema or swelling, can reduce pain through its anti-inflammatory effects, and it can help modulate collagen, both secretion and maturation, which is really important for wound healing and tissue repair. So this is a lot more of a complicated diagram, but essentially all I really want you to show you here, it has a primary effect on the mitochondria, and then you have the secondary and tertiary effects really revolving around protein production, that kind of thing. Again, I won't get too much into that in today's lecture. The other thing that's important to understand about photobiomodulation is that there's something called a biphasic dose response. And again, without getting into a lot of detail, essentially, if you have too little light, and that's represented from A to B, there's no positive effect. It's just not enough energy to cause anything. It's basically trying to grow a plant in a dim, dark area. It's just not enough light for anything to happen. But as you increase the light, in this case, photobiomodulation light, you actually start to get a positive effect, wound healing and all these other things I've talked about. And there's sort of a window of how much dosage is going to be really helpful. In this case, an optimal amount is shown from C to D. But then if you overdo it, if you give too much energy, you can see that there's diminishing result, less and less photobiomodulation. And if you really overdo it, like way too much energy, then you can actually inhibit photobiomodulation. However, this type of dosage can be used to reduce pain in animals as well. But that's using a much higher powered laser, a lot more dangerous kind of laser, potentially heating effects. One that is therapeutically great for reducing pain, but not therapeutically great for photobiomodulation tissue healing. So in the case of at-home treatment, really the only option is to be using class 3B or LEDs, which promote photobiomodulation. And to be honest, that's the most important thing. You want your animal to not only have less pain, you can do that through reduced inflammation, but also help the tissue to heal. Right. So as I mentioned earlier, there's direct and indirect or systemic effects. Direct effects are when the light's absorbed directly into the cells and the tissues that are injured or diseased. Indirectly or systemically, as I showed you in Messer's experiment, that's where the light's absorbed in the blood, specifically circulating white blood cells and stem cells. Then, of course, they're carried in the blood and they're attracted to chemical mediators released when you have arthritis or tissue injury or what have you, and they congregate there and help that area reduce inflammation and help the tissue heal. This is a really cool experiment that I always show or talk about when I'm referring to a systemic effect. I'm not going to spend a lot of time on it, but I just want you to show you how powerful it is. And basically, this was done in part by Yuri Oron, who I personally know. He's a researcher out of Israel. What they did was they used a coronary artery balloon to cause a blockage in a specific artery in pigs. So they created a small myocardial infarction. And what they did is before they did that, some of those pigs were treated with laser or photobiomodulation therapy, not over the heart, distally away from the heart in the tibia, specifically the bone marrow, right? So they, actually drilled a hole and they could put it right into the bone marrow. So they treated some pigs with light in the bone marrow. Other pigs got no light. Then they did the coronary balloon infarction, which created a myocardial infarction. And then they looked to see the size of the infarction post-MI to see if there's any differences in the pigs that were treated with light therapy. This will blow you away. Okay, so what happened here is the white tissue that you look at that's circled in yellow here, that's scar tissue. So that's where the myocardial infarction was in the non-laser treated. Now, if you look at the laser treated pig, you can see just a little tiny bit of scar tissue. It was approximately 80% less tissue damage where the pigs had been treated with light therapy. And I'm going to show you sort of slices or coronary slices through the myocardium. And you can see, again, comparing the non-laser to the laser group, significantly less scar tissue and damage to the heart compared to those that were treated with laser. And so you might say, well, what's going on here? Actually, what's going on here is that the light increased the number of circulating stem cells in the bone marrow where they're produced. And those stem cells are now in the blood circulation. And stem cells are sort of are drawn to areas where you have tissue damage, in this case, the heart. So by having more stem cells available to repair, you actually had more repair going on and less scar tissue going on. So that's an example of a systemic effect of photobiomodulation. It's really important. Us at Bioflex, we focus a big part of our treatment regime on systemic effects because of how powerful it can really be. Lots of clinical applications, both in the veterinary world and in clinics, but also at home with the system, everything from improving blood flow, helping nerves heal, cartilage heal, bone heal, muscle heal, and other types of tissues as well. And I've already kind of alluded to that earlier. Very few contraindications. Essentially, you don't want to use it over actively bleeding tissues. You don't want to directly treat over an area of carcinoma or cancer. Very few side effects. In fact, when I say very few, they're equal to placebo in clinical trials. And really, there are no known negative side effects with this therapy, so you'll never make your pet worse with this kind of therapy. This is just a little quote from a journal called Photobiomodulation Therapy in Veterinary Medicine, a review in 2018, a journal article. And at this point, now this is now 5-6 years ago, they conclude that there's enough evidence exists to justify its educated use in clinical practice for a myriad of indications. And those indications, for example, as I've already talked about in cats and dogs, muscles, ligaments, tendons, fascia, cartilage, joints, fractures, you name it, soft tissue or even osseous tissue or joints or ligaments, they can all benefit from photobiomodulation therapy. Nerve-related conditions, especially in dogs as they get older with degenerative disc disease and nerve compression, those kinds of things, this can be very helpful as well. And skin issues, folliculitis, impetigo, dermatitis, rashes, even to some degree, the inflammation secondary to skin infections can also be very helpful. And as I've already mentioned, wound healing. So recalcitrant wounds and ulcers and post-surgical healing, burns, lacerations can all benefit from photobiomodulation therapy. As I mentioned earlier, there's actually a fair amount of research. So if you want to find the research, you would go to PubMed and search for photobiomodulation or LLT, which is the old acronym for low-level light or laser therapy, and in this case, veterinary applications. You can see here there's well over 200 papers to explore if you're interested in that. Just a few of these research papers. This was published in the journal Companion Animal Medicine in 2018. And here they mentioned that in the majority of animals, hair, coat, and pigment are inevitable and can predictably impact delivery of photons to the treatment site. Light penetration is highest for light-colored hair, lowest for dark-colored hair, and clipping the hair may improve energy delivery. So you do need to be aware of that. I'll show you some strategies for trying to overcome some of these issues as well. And of course, the size of the animal. A small cat requires less dosage than a large animal like a lab, for example. This particular paper was published in 2022, and it looked at the effects of low-level laser therapy on improving mobility with dogs that have osteoarthritis. They looked at 23 dogs, and they were instrumented with what's referred to as an accelerometer. So they basically measured their movement from baseline, and they underwent 6 consecutive weekly laser treatments. And they looked at something referred to as the canine brief pain inventory and the Liverpool osteoarthritis in dogs. And they looked to see what the results were. And essentially, they found that there was an improvement in their mobility and their pain. And overall, they concluded that laser therapy may advance the management of osteoarthritis by increasing the level of activity of dogs and therefore improving their quality of life. Now, I'm not saying that this is the only thing that you're going to be doing with your companion animal if they have arthritis. I am saying that this is a huge part of helping slow the progression down and reducing the symptoms in a natural way, and perhaps maybe avoiding things like cortisone injections and other medications that have side effects and actually may eventually accelerate the issues in arthritis. This one I thought was really interesting. So photobiomodulation is being used in humans transcranially over the cranium for cognitive issues. And so this paper I actually just saw recently, and it looks to see if you can improve cognitive functioning in dogs that have something referred to as canine cognitive dysfunction. It was a small study, like just 5 dogs. But they wanted to look to see if these 5 dogs, they were senior dogs, obviously, if they had any improvement by treating around their skull and their brain. So they were instructed, the dog owners were instructed on how to use the device. They treated their animal, their pet, 3 times per week for 1 month and 2 times per week for a second month. And again, no other therapeutic measures. And then they looked at baseline cognitive scores, both at 30 and 60 days post-treatment. And again, what they found was that the result of this small case series suggested that transcranial photobiomodulation may improve cognitive scores. I think 4 of the 5 dogs showed significant improvement. Let me just back up to see if it said that here. Yeah, I didn't put that in, but it was 4 of the 5 dogs had significant improvement. Okay, and I want to just give you this really fascinating story. Well over 30 years ago, when the company was being formed, we had sort of our owner at the time owned a racehorse, and he actually bought this racehorse that had won the 2010 Breeders' Cup. I'm not a big horse race fan, but apparently this is a big deal. The horse's name was Awesome Feather, and leading up to its win, it had never lost a race, and actually ended up winning the Breeders' Cup. And then it was purchased for $2.3 million a few days after her historic win. Now, that wasn't what our owner paid for it. What happened was the horse actually went lame shortly after its purchase by a wealthy person, and they decided that it just could no longer actually race. And that's where our owner came along, Fred Kahn, and he actually purchased the horse and said, hey, I can make this horse better with laser therapy. And indeed, the horse was treated with Bioflex laser therapy for a couple of months, along with intensive physical therapy, and actually went on back to race several races and even won some more races. But further injuries and some issues, and eventually a few years later, the horse was again retired, but it was a little bit older. But it just goes to show you the potential for laser therapy, not just in companion animals, but in the equine world as well. The equipment looks something like this. You can see that there are 8 dots that represent 8 anatomical regions on the controller for cats and dogs. And these particular dots are what you would use for soft tissue injuries like muscles or ligaments or tendons, or joint injuries like arthritis and so forth. And then there's 2 other areas that you can use. One is a skin protocol, and one is for wound healing. So you can see what looks like sutures, that's for wound healing, and the one that looks like sort of skin with a hair follicle, that is for skin conditions. Again, these are used for both cats and dogs. And the lower portion of the controller has a power on-off feature, a stop, a start, pause, and select the companion animal selection as well. So for example, when you choose the lowest level, so when 1 bar is lit up, that is for cats. When you click it again, level 2, that is for small dogs. You click it again, you get 3 bars, that's for medium dogs. And then when all 4 bars are showing, that's what you would choose if you have a larger dog and treating a larger dog. And again, the dosages would be different for cats and small, medium, and large dogs. So you got to make sure you choose the correct dosage. In general, for treating just pain and inflammation that's quite acute, you can treat twice a day, roughly 8 hours between sessions, starting off with sort of level 1 intensity. And then for arthritis, a little bit more chronic condition, usually I recommend treating once a day. and typically 2 to 4 times a week. So the odd day off, and again, at level 1 intensity. For wound care, you would select the wound care and typically do 3 to 6 sessions in level 1. And then as it's healing, you would go to the next level, which is 2, another few sessions, maybe 3 to 6 sessions. And then if it's not healed yet or still slow to heal, then you would go to level 3 or 4 as needed. And again, for wounds, especially, I would recommend treating both morning and evening to really accelerate the wound healing capacity. That's the wound healing portion that you see there. Similarly, for post-op wound healing, so if your animal's had surgery, usually it's shaved, again, you would place the pad. I'd recommend using saran wrap or clear plastic wrap over the light pad. And again, you would just start off with level 1 for a few days, and then up it to level 2. And then if it's still not healing or slow to heal, they can go up to 3 and 4. For skin conditions, rashes and skin infections, those kinds of things, I'd recommend applying once daily, at least for 4 to 5 days in a given week at level 1, and then you can slowly increase, but you would only increase the energy dosage if it's not healing nicely or not responding the way that you would like. And again, this would be the dermatological button that you would choose for that. So cats and dogs, they seem to really enjoy treatment. I find that they kind of relax for the most part. They're quite easy to treat. They do give off a little slight warmth because of electrical current, so maybe that's why they're kind of chill. You in general will have to hold the light pad against them. However, you can also use a strap to hold it depending on the size of your animal as well. When placing the light pad against your pet, you want to gently move the pad side to side, and that displaces the hair to allow as much contact to the skin as possible. The diodes actually protrude out a little bit to make better contact with the skin. And again, if you're treating an acute or fresh injury, I do recommend probably twice a day, morning, evening, and then you can progress to every other day. If your cat or dog has dark skin or fur, you can maybe add some extra treatment time. So just kind of repeat it for an extra minute of red or extra minute of near infrared. Ensure the hair is not wet or dirty, as this may affect the light absorption. And medications don't really interact with light. Perhaps cortisone or steroid-based injections or medications may reduce the efficacy or effectiveness. So you can kind of wait for a day or two for that to clear out of the system before you use the light therapy. When you're treating a joint like a knee or a hip, you want to treat around the entire joint, not just on one side of it, as that helps with the systemic effects entering inside the joint. And again, as I mentioned earlier, if you're treating a surgical or a wound area, you can wrap the light pad in transparent plastic wrap and hold it gently against the sutures. If it's a big bandaged area, the light won't really penetrate very well, but you can still treat around that area. So that works out as well too. To clean your array, just use 70% alcohol solution and just gently rub it with a non-abrasive cloth or paper towel or a mild disinfectant. Don't immerse your equipment in, obviously, water. And again, if you're using the straps, they can just be machine washed as well. Okay, wonderful. So the remainder, a few minutes, I'd like to introduce the healing movement. And this is our exclusive distributor for this device. Dave Poggi would be your liaison, a person to speak to about this equipment. And I'm going to ask Dave to chime in. Hey, Dave.
Hey, David, thanks so much for going through that presentation. That was awesome. Really appreciate that.
You're very welcome. So I'll let you introduce yourself, and I'll move the slides accordingly.
Awesome. Hello, everyone. So my name is Dave Poggi. I'm the president at the Healing Movement, and thanks for joining on today's call, and to David again for that presentation. It's being sensitive of the time, would love to give a brief introduction to our company and give you an overview of what we're about. So essentially, our mission is your pet's journey to recovery starts here. At the Healing Movement, our mission is to educate and provide access to therapeutic solutions for pets. We view pets as family members. Our goal is to help people provide the care for their pets as they would receive during recovery and rehabilitation. With best-in-class science and technology combined with our rental model, pet owners can now access this affordably in the comfort of their own home. So this was born out of inspiration from my own journey with my senior pet. I had a dog that suffered an ACL injury, and she was not a great candidate for surgery. She was about 9 years old and had a fairly moderate heart murmur. So in consultation with our vet, he suggested we could try conservative management. So that was, restricting the pet, allowing the wound to heal since scar tissue will form. But knowing that with my background was more in sports medicine on the human side, knowing that that needed to be supported with rehabilitative care for it to be effective and have a chance at success. So where that led me to was working with the Animal Rehab Center in Yorkville, who does amazing work with manual therapy and using a variety of these modalities to help pets recover from injuries. So saw some incredible results from that. I was incredibly grateful to, give her quality of life, regain mobility, and just felt like it was something that was lacking education and that people didn't realize these options were available for their pets. Then fast forwarding a few years later during COVID, she tore her other ACL, and I essentially was looking to gain that same kind of care, but everywhere was booked up given the nature of distancing and the influx of demand for these types of services. So I ended up seeking out a PEMF mat as well as a laser, and essentially perform these treatments in the comfort of my own home. And within 6 weeks from a complete ACL rupture, she was back to climbing the stairs, and it bought her extra years, and it kind of spurred the inspiration to want to make an impact in educating others that there are solutions available. These are highly effective, that it isn't hopeless if you have a dog that perhaps isn't a good candidate for surgery. And there were a lot of other reasons that went along with that. Some of that could include proximity to a community that might not have one of these practitioners that has all the access to these various modalities. Some of it is cost effectiveness. So we'll touch a little bit on our rental model. But as David mentioned, in an acute situation, be it post-operatively or, after an injury, the frequency of care could be once, twice a day. So that's not realistic for everyone in terms of the time and the cost associated with that. And that's why our mission is to make these modalities more accessible and affordable, and in the comfort of your own home. So going into some of the pricing, for example, these units similar to the human units, to purchase $24.99, rental would be $349 a month. Shipping is covered. We take care of all aspects of shipping, both to and back to us when the rental period concludes. We have the two different options for the 120 and the 180, the 180 just being more diodes and a larger surface area, but that can also just be repositioned with the 120, for cost effectiveness. So moving into the PEMF technology, we have a couple different options. We have mats as well. We have the coats. With respect to PEMF technology, some of the benefits are similar to laser therapy. Those would include cell proliferation, collagen formation, reduction of inflammation, increased circulation, increased oxygenation of tissue, and pain reduction. So, a different type of modality. We've also seen some incredible results working with some of our rehab practitioners in that it calms, anxious dogs down. It can also be used synergistically with the laser therapy. So if there's a dog that's anxious, be it in a clinical setting or at home, you could have them doing both at the same time. So we partner with a brand called Sport Innovations on the PEMP technology, and we'll send all the details in terms of the website that you can check out more of the options and what it's all about. We also have a proprietary recovery bed that's manufactured in Canada. Part of my dog's recovery journey was also using this product in that it provided incredible support. The nature of most of the beds in the industry are that they do not provide a lot of support. It's an unregulated industry, and that there's a lot of claims about orthopedic beds, but really they're all developed with the same low-cost materials that really provide no support. You can see how, this is one of my dogs, and she's kind of young at the time, but you can see how she kind of just floats on the bed, that she's not sinking in, provides an incredible base of support. The reason that that's important is, any dog that's ailing, being arthritic or post-operative or has an injury, the instability of getting on and off the bed can aggravate those injuries. So what I used to notice is when my dog would get off the bed, when I had, the recovery bed, essentially, she wouldn't be limping away versus some of the other beds that I had prior to that. It also has some unique technology with respect to cooling properties. So a lot of dogs run incredibly hot. They want to sleep on tile or over a floor register, for example. This has a middle layer of foam that is porous and allows air to flow through, and then there's a cooling layer of memory foam. So we're pretty excited to introduce these different products, and our goal is obviously to make an impact in helping people feel like they have options to care for their pets in the comfort of their own home. And what we'll do is share the contact information. I will also share our website in the chat. We did see some questions come up about the usage of some of the traditional Bioflex products for canine therapy, so I can get some answers for you on that from David offline. But you can email either of us at david@bioflexlaser.com or dave@thehealingmovement.ca, and we can definitely get you some information on that specifically.
Thanks, Dave. The website is thehealingmovement.ca, correct?
Correct. Yeah, and I just put that in the chat for everyone.
Okay. Wonderful. Thanks very much, Dave, for doing that introduction and allowing everyone to sort of see the kinds of products and devices you have for companion animals. Again, if you have any specific questions for us, you can email myself or Dave. And there was a question about using an existing human system for animals. You can. I actually did a webinar on how you can kind of do that. It's a little clunkier, you might say, but if you already have a human one, then there's ways of doing that. So just check out our website for personal therapy webinar archive, and then you'll find one I did on pet care for that as well too. So thanks again, Dave. I really appreciate you giving us that information, and thanks everyone for joining me today. I do appreciate that. I'm just going to see if there's any specific questions I may have missed here. So just give me a second.
The last thing I'll add to, David, is we'll be hosting some of our own webinars. So if you're interested in learning more about the various modalities and the programs that we have available, we are working with rehab practitioners as well as vet practices. We'll be hosting some additional webinars on that specifically. You can always register on our website to be added to our database, and we'll send some updates on when those webinars will take place.
Okay, wonderful. Again, thanks everyone for joining in, and we'll see you at next webinar. Take care.